gastric ulcer and massive upper gastrointestinal bleeding. A 58-year-old woman was rushed to the emergency department following 3 bouts of hematasis and a single bout of melena. On examination, she was tachycardic and hypotensive at 121 beats per minute and 90/50 mmHg. Respectively, she manifests paler but with no icterus. She is eunipic and normothermic, but reports intermittent preumbilical tenderness. Medication history reveals occasional intake of non-steroidal anti-inflammatory drug naproxen, 250 milligrams for arthritis management. On admission, her complete blood count revealed a hemoglobin level of 5.1 G/DL, hemocratic of 32%, prolonged prothrombin time, and a positive gout test. All other laboratory studies were within normal limits. Based on these clinical presentations, intravenous fluids were administered and 3 bags of packed red blood cells were transfused. A gastroenterologist was consulted and an upper gastrointestinal endoscopy was performed, which revealed a 1 by 1 centimeter hemogastric ulcer. The bleeding ulcer was cauterized and biopsied and was taken for hypoglycemia, the results of which are negative. Proton pumps inhibitors were started and she was discharged after 2 days in stable condition. Uncontrolled non-insulin dependent diabetes mellitus. A 50-year-old woman with non-insulin dependent diabetes mellitus was seen in her primary care provider's office with reports of diminished sensation in both feet and occasional blurred vision. The client admits to problem adhering to her prescribed dietary and medication regimen. She doesn't exercise regularly, take her medications when she is reminded, and doesn't watch her diet. She denies dysplasia, and diapohirtasis. The client had a history of non-insulin dependent diabetes mellitus for 15 years and dyslipidemia and hypertension for 8 years. She had laser photoconstellation for renopathy in the past year. She's on metformin and glipizide for control of hypoglycemia, hypochloride, and Rampicil, and a for hypodelemia. On an examination, her blood pressure was 180/98 mmHg. Fasting blood glucose is 265 milligrams over deciliters. Hemoglobin A1C is at 9%. Serum blood urine nitro and creatine are 53 mg/dl and 4.4 mg/dl respectively. Urinalysis and 24-hour urine collections uncovered trace protein and urinary albumin excretion rate of 250 milligrams a day, leading to the diagnosis of microbillinuria. Nerve condition studies and echocardiograph confirmed diabetic neuropathy. Deceased visual accuracy and new intensive retinal vascular growth were relevant through an exam. Based on the client's typical presentation, the final medication impression and diagnosis is uncontrolled insulin-dependent diabetes mellitus completed with hypertension, neuropathy, retinopathy, and microalbuminuria. I know I totally bombed that.